Good afternoon, everyone, and welcome to the Memphis and Shelby County Joint Task Force. A lot has happened since I've been able to join the press conference, so I'm excited to be here today. We have two special guests with us, and we're going to focus on one, getting back to work, but also getting back to school. And before our guests join us, I'm going to give an update, as I always do, highlight a few key things, and then I'm going to turn it over to Commissioner Lowery to make a special announcement. And then after that, I'll introduce President Jack Shannon with Christian Brothers University to talk about their back-to-school plan. We are continuing to see the benefits of masking, not only the city ordinance, but our countywide health directive, as well as the closing of limited service restaurants and limiting time that people can be out late at night by instituting early closures of restaurants. We are stable and have been stable for some weeks now and are running about 250 to 300 cases per day, which is a significant decrease under the 500, 600, 700 that we had seen in July. Today we have 24,057 cases. That's an increase of 247 from yesterday. Unfortunately, we have to announce that we have 308 deaths. The majority of those are confirmed, and a handful of those are probable deaths. I want to point out that we continue to have a 1.3% mortality rate, which is significantly lower than the rest of the country. And there are several things that contribute to that. One is that we have a younger population that's impacted, but it is also a testament to our healthcare systems locally. That's one of the strengths of Shelby County, and we are experiencing positive outcomes as a result of that particular strength. At the current time, our overall positivity rate is 10.8%. We'd like that to be a little bit lower, but it is slowly coming down. And for the week ending of August 1, we have a 15.3% positivity rate, which is a decline from our high of almost 17%. So again, we're seeing stabilization and a downward trend from those very high numbers that we had mid-July, which is very, very important. We've been able to close over 59% of our contact investigations, and that's important because that is how we prevent the spread to others. And at the current time, we have identified over 22,000 contacts, and all of those contacts were placed in quarantine to further reduce transmission. As of today, we currently have over 9,000 people that are actively under a quarantine order. I want to give a few updates on testing, because also in mid-July, the testing centers had really extended way beyond their capacity. So I'm very proud to say that with hard work from all of the community partners who do testing, our capacity is back up again. We have over 8,000 available slots per week. We are also assuring that people have adequate access if they call for an appointment. One of the questions that's continued to come up as we get back to school is testing of children. So each of the community-based sites is going to begin to post what age groups they can test. So if you want more information on whether your child can be tested at a community site, please go to the COVID-19 site at the City of Memphis, and that's where the schedule is posted. The lab turnaround time has also improved significantly, and again, that's a testament to the partnership and work of the laboratories. We're back down to a 1 to 3 day turnaround on average. Occasionally it's slightly longer, but that's a significant improvement over what we had 2 weeks ago. As a community, we're also exploring new testing modalities, particularly saliva testing, which makes it much more easier to collect the specimen and get those specimens run. And we are also looking at antibody testing locally. More to come on that as those explorations move forward. We are also doing some piloted asymptomatic testing that's being done primarily through the City of Memphis, but I want to report that that is going well and will help us in our efforts moving forward to expand asymptomatic testing. Also want to point out that we've issued Health Directive number 10. That can be viewed at Shelby TN Health. If you have specific questions about the Health Directive, you can email us through that portal, and either myself, Dr. Randolph, or David Sweat will respond to the inquiries that you have. I want to talk a little bit about hospital capacity and then give some updates on our staffing. While we have a significant number of hospital beds occupied, the hospitals currently are able to meet the needs of our community. The surge capacity site at Commercial Appeal stands ready for use, but at the current time, there's not a need to open that facility. All of our team members that are our COVID response team have moved to the Dividend Drive property with the exception of a small group. We posted 141 positions. We have filled 125 of those positions. That means we have only 16 remaining. And those are very specialized positions, such as epidemiologist and clinical leadership positions. There's only 2 vacant contact tracer positions. We are also working closely with administration to post additional contact tracing opportunities for part-time, and those would be evening and weekend hours, so more to come on that in the next week to 2 weeks. But what I want to really point out is that all of our efforts are paying off. We had a difficult time, as we all know, in the early part of July into the middle of July, but we're reaping the benefits of our ability to adjust quickly and implement strategies to reduce transmission. We will continue to evolve interventions based on what the data tells us, but at the current time, my message is to stay the course. We have to continue masking. We have to continue hand washing and social distancing. At the same time, we want to balance getting back to work and getting back to community and getting back to school. So as we shift our focus both in our health directives and in the community, and we contemplate how we can reopen businesses safely and carefully, we would like to introduce a new health and safety grant program. I'm very excited about this. This has been under discussion for some time, and so I'm very happy to announce that we will be offering a grant to what we call close contact personal service businesses. And those are businesses like barbershops, beauty shops, nail salons, tattoo parlors, and any other business where there's prolonged periods of close contact with the customer, making it very difficult to social distance while at the same time operating that business. We know that our restrictions have impacted those businesses, and we want to help those businesses along. We have, and over time, as everyone is aware, we have implemented fairly stringent restrictions on those businesses, everything from wearing masks to staggering schedules, limiting access to the waiting rooms, and having increased sanitation. So to help support the professionals and customers who visit these businesses, Shelby County Commissioner Mickell Lowery is here to talk about a new grant that's available to business owners in those affected communities. So we're excited to have Commissioner Lowery here. He's going to give an update on the grant, and then I'll come back to introduce President Shannon. Thank you.
Thank you, Director Haushalter. Today, I'm pleased to share more information about a collaboration between myself and the Shelby County Board of Commissioners and the Shelby County Mayor's Office. As we shift our focus to look ahead and consider how we protect vulnerable populations, keep residents safe, and support our business community, one such community rises to the top. In March, near the beginning of COVID-19 pandemic, we were forced to shutter close contact personal service businesses. This included many barber shops, beauty shops, nail salons, and others. Because of how COVID-19 is spread, the frequent face-to-face contact and the amount of time spent in close proximity to others made keeping these businesses open a public health concern. Barbershops across the county were closed for over 5 weeks, and many remain closed much longer because of the lost income and the new expense of reconfiguring their space to allow for social distancing. I know because my own barbershop was affected. Unlike restaurants, other types of businesses, there were no legal alternative to safely provide a haircut. The same was true for beauty shops and nail salons. Today, many of these businesses have reopened, but things look drastically different. Our health directive requires them to reduce schedules, limit access to waiting areas, require masks for all clients, and encourage the use of disposable capes and other supplies. Most adults in Shelby County will visit at least one close contact personal service business before the end of the year. We want to do what we can to keep these businesses open. We also want to keep these businesses safe. That's why, effective today, every owner of a brick and mortar beauty shop, barber shop, nail salon, or other personal contact service business is invited to visit our website and apply for the $2,000 Our Beautiful Comeback Grant. This grant allows business owners in the industry to purchase the necessary sanitation supplies, PPE, and to keep their shops open and open safely. One important note, these are grants, not loans. A business that operates safely does not have to return or repay these funds. Mary Lee Harris and I understand that these businesses are under a unique strain, and as we move towards the safe and careful reopening, we want to do our part to protect all Shelby County residents who must navigate this new normal. Information about these grants is available at covid19.shelbycountytn.gov. You can see that link in the ticker. We encourage all brick and mortar businesses owners to apply that are in the beauty industry for our Beautiful Comeback Grant as soon as possible while funds are available. Thank you.
Thank you, Commissioner Lowery, and I want to highlight the role of the County Commission throughout the pandemic. They've been very supportive of all of our efforts, and they have come forward with a lot of great ideas, including this particular great idea, and so we're very excited that the county can offer this particular grant to our personal service businesses. I next want to introduce President Jack Shannon with Christian Brothers University. He's also worked very diligently with his team, with the health department, and with other experts to create a safe environment for students to come back to the university. Thank you. President?
Thank you, Dr. Haushalter and Commissioner Lowery. I want to acknowledge and express our gratitude at CBU for the guidance and counsel and support that you've provided to us as we worked our way through this COVID pandemic starting back in March. You have provided consistent, comprehensive, and objective advice based upon public health data, and in turn, we've made sure that our plans for reopening the campus this fall fully comply with the guidance you provided. As announced, CBU will be opening this coming Monday, August the 17th. This is a week earlier than most years on our campus. We have decided to cancel our fall break, and we'll be wrapping up all final exams the Wednesday prior to Thanksgiving. Our goal in adopting this schedule is to minimize travel back and forth from the campus, to limit exposure for our students, faculty, and staff who might otherwise be making multiple trips throughout a typical semester. We already have students who are moved in on campus. They are our resident advisors. They're busy going over cleaning protocols and extra steps we're taking this year to ensure the safety of our students. In addition, they are going to be doing the work they do every year to make sure our residential students are well cared for. We also have a number of international students at CBU who have arrived and are currently in mandated quarantine. They're waiting safely in off-campus housing where they can be isolated for the required period of time. We look forward to welcoming them shortly on the campus itself. When the rest of our on-campus community arrives, they will be living in single occupancy rooms. We have adapted everything within our residence halls to make sure that we can offer a safe environment for these students and their fellow residents. We have adopted new procedures for move-in. We are limiting student activities on campus. Many of those will be virtual this semester. And we are looking at all possible ways to limit exposure while at the same time providing ways for our students to interact and learn as we want them to during the fall semester. Let me be clear, however, while we will have students living on campus this fall, nearly everything about the fall semester will be different at CBU. Our cafeteria is focusing on meals that can be picked up and enjoyed outside or in student rooms or staff offices. Many of our campus offices will continue to offer remote or virtual services to our students and others. You'll be able to chat, for example, with a librarian online or a career counselor virtually rather than in person this fall semester. If I can say there's one good thing that might come out of this pandemic, is that we've rethought how we conduct our business day in and day out, and many of the virtual options that we have adopted in light of the pandemic, I anticipate that we will continue to offer because it provides us the opportunity in true LaSallian fashion to meet our students where they are and provide them with the services they need, regardless of physical limitations or time of day. Most importantly, we've been able to move most of our courses online to reduce campus density this fall semester. As of last count, over 80% of our courses will be offered either hybrid or online fully. Of those classes that will be meeting face-to-face, excluding our courses for our nursing and physician assistant programs, only 5 classes will have a student enrollment of over 16, and only 27 will fall within a category of having between 11 and 15 students. Our total number of face-to-face or traditional courses on campus this semester will be 147, representing, as I said earlier, only 20% of all courses offered this fall. In our case at CBU, being small has helped us be nimble. We have tested all of our buildings and replaced air filters to allow for improved airflow and greater safety. We've been able to adjust classrooms, layout, and design to allow for the maximum of more than 6 feet of safe social distancing between participants, be they faculty or students. We've also made a significant investment in the support we can offer our teachers and faculty who are offering course content online, both in terms of the technical needs they may have and the trained personnel who work with our faculty to bring out the very best in what online learning can offer our students. Let me close by going back for a moment to those areas where we have the most in-person instruction, our nursing and our physician assistant programs, as well as some of our science and engineering labs. We are taking every precaution possible to reinforce the health protocols provided to us by Shelby County and other public health experts, and we are mandating social distancing, hand washing, and mask wearing throughout the campus, as well as enhanced cleaning throughout the day. But as we're seeing every day, these areas of engineering, PA, nursing, and science are critical areas for our community and for our world. We are committed to supporting these students, therefore, and encouraging them in their studies. We can see in times like these that their special skills are needed more than ever, and we will continue to be needed even after the pandemic has passed. I'm proud that our engineering students used their design skills to make face shields for Regional 1 health professionals earlier this year. I'm equally proud that our physician assistant and nursing students are preparing to be on the front line of any health crisis here in Shelby County in the Mid-South region. Our work of preparing tomorrow's leaders, be they in healthcare, engineering, sciences, government, or other fields, continues unabated at CBU, even while it looks different than it ever has before. Dr. Haushalter, I thank you for this opportunity, Commissioner Lowery as well, and I ask every one of our fellow citizens here in Memphis and Shelby County to continue to mask up. It is making a difference, and together we'll be able to beat this back.
Thank you, President Shannon. And that was 2 great examples of where data has been used to drive decision and action. One, to safely get students back to a university campus so that they can learn and prepare for the future. The second, in hearing back from businesses and the impact that many of our restrictions have placed on those businesses, the County Commission and Mayor Harris have moved forward to help those businesses stay open and stay safe. So we'll open it up for questions. Thank you.
Kendall Downing, WMC.
Hey there. So I wanted to ask about school districts. I was wondering for my first question, is the health department or the community site, is there a coordinated effort with school districts to test students, or is that testing something that would need to be done at the family level? And then I'll have a follow-up.
So that's actually where the piloting is occurring, is that the piloting asymptomatic testing is being done currently and offered to Shelby County schools and some private schools. What we're looking at, and that's more within the city, but we're looking countywide as much as we can, looking at the workflow, whether that works or not, and what the positivity rate is or is not before expanding. But also our community-based sites, one of the reasons they're opening their slots to children is so that if there's a need for a child to be tested, that child can be tested. So more to come. A lot is happening in the testing arena just over the past few weeks, particularly as newer modalities are coming to the market. And as our capacity is increasing, then we can begin to broaden our list of prioritized populations to include teachers and other frontline employees.
Is it safe to say that pilot program, is that a pool testing strategy that we've heard talked about?
Right now it is pool testing. What happens over time with pool testing, there has to be a calculation of the positivity rate, and if the positivity rate is too high, you have to move away from pool testing. So that's why it's being piloted, so that we can see if that's the best strategy for our county, for educators, and for potentially children as well.
Brad Broders, Local 24.
Thanks. Good afternoon. Dr. Haushalter, question for you. I'm sure you're aware there's already been cases that have emerged in Alcorn County, Mississippi, Corinth, Mississippi, that district in Georgia. What would be your message to parents as some districts have some sort of in-person learning? What should parents realistically be prepared for in terms of likely new cases coming online this fall? And do you think what we've seen so far requires any potential tweaks in the safety protocols? And I have a follow-up.
So the first message I would give to parents is to really understand what their school district or their particular school is doing to reduce transmission. They want to make sure that the classroom is designed so that there is social distancing. Ideally, children should be wearing masks, the teachers should be wearing masks, and positive, how that's communicated to the families, and how action is being taken within that facility. We're going to work very closely with the schools to make sure if there are any cases that they are picked up early and that there is quick intervention that occurs to reduce transmission. But I think we all have to recognize as we get back to business, there is going to be some transmission. The key is to reduce that transmission to the lowest possible number as possible. And with that, what has to happen is parents have to also help their children feel comfortable and learn how to wear a mask properly, and know what to do if that mask becomes soiled, because they need to change it. They need to make sure their child has a mask, whether the school provides it or the family provides it, and they want to reinforce the importance of hand washing with children. We tend to overlook and take for granted hand washing, but that's actually the first defense that we all have, and that's really important as we move into flu season. And then I would also say being very attentive to your child's health and well-being. We all know, those of us who have children know, there are very minor nuances that we pick up on that let us signal or be signaled that our child is ill. And if the child is ill, please do not have them go to school, have them stay home so that they can recover, one. But secondly, if it is COVID, you can determine that quickly and get them tested. And you have a follow-up question?
Thanks, Dr. Haushalter. In depth as always. Yes. A follow-up question is that this weekend there was a nightclub in the New Chicago area which was selling food at 4 a.m. but still it was a nightclub that's serving food. Can you clarify the rules of when clubs who are allowed to open but serve food, when they're supposed to close?
So they're supposed to close by 10. Sometimes what we find is there might be a venue that's not licensed as a restaurant, or there may even be individuals who host parties that sell food. So what I'm going to ask is what we've asked all along, is if you're aware of a event like that that occurs that's not consistent with the health directive, please give us notice. That can be sent email through Shelby TN Health, or you can call the Mayor's Action Center, or you can call 211 and we will follow up. Typically what we found is there are individuals who may not fully understand how the health directive applies to them or their business or their activities. There are on occasion individuals who blatantly do things at 3 or 4 in the morning to avoid the health directive. I want everyone to know we function 7 days a week, and that there are people available 24 hours a day as needed to address issues that come up in the community. So please report those to us so we can follow up and reduce transmission.
Jane Roberts, Daily Memphian.
Dr. Haushalter, can you give us a little bit of color on how long it will take to get the grants for the salons and nail businesses?
My understanding, they're ready to take applications today, and they will be expedited very quickly. So I can't say a day or 2 days, but I can tell you they're taking the grant applications today, and we'll move quickly to get those funds dispersed to everyone.
And my follow-up is, do you know how much overall money has been set aside for this?
No, but I can actually ask Commissioner Lowery if he knows.
Sure. Thank you. So we have set aside $1 million to support 500 qualifying business owners.
Stacy Jacobson, WREG.
Hello, can you hear me?
Yes.
Okay, thank you so much for taking our questions. Dr. Haushalter, I wanted to know if you can identify any areas other than encouraging more mask usage and closing bars that has helped us to lower their numbers. Are there any lessons here, behaviors or places that can really help people that they can avoid, or behaviors that they can do that can help people to continue to be safe in the future?
Sure. So clearly I have to reinforce mandatory masking. That has made a difference significantly. We also know by closing limited service restaurants and having restaurants close early and stop the sale of alcohol at a specific time that it reduces behaviors that we know contribute to transmission. And those behaviors I'm going to identify because that's really where you want to focus. We do know when people drink alcohol, they are not able to properly wear a mask. Also, when people engage in drinking alcohol or alcohol consumption, they're more likely to be louder. They're more likely to be closer in proximity to others because they're being more social. They may also tell more jokes. They may sing along with the music. And these are all things that contribute to transmission. So I encourage people in their personal lives as well to consider what activities they engage in, whether they have events at their home, how many people are there, how long do people stay, is there hand washing supplies available, are people wearing masks or not wearing masks, but also making sound decisions on where to travel, when to travel, and what events to attend. On previous press conferences, I use my own personal example. I try to practice what I preach to the community. An example is I don't visit family members that live in another community unless there's a necessity, even if there's an event. I know that there's transmission in that community. We have transmission here, so I opt not to go to those events or try to do things virtually. So really stepping back and saying, yes, we have transmission in our community, and what events should I avoid? How do I also help young people, particularly children, learn to hand wash and also help protect our vulnerable population? So that may mean limiting visits between grandchildren and grandparents, trying to do things virtually, or making sure that children are masked and their hands are washed. Do you have a follow-up?
Yeah. Are there other locations other than bars and limited service restaurants where you were finding high transmission?
No, but I'm getting back to the behavior. So I've said before, the data that we have locally doesn't always pinpoint a specific place. So we have to focus on behaviors. So any location that would support the behaviors that I just identified should be avoided, whether or not we have data that indicates there's transmission in those particular areas. We do know throughout the pandemic we've had transmission in workplaces, transmission in healthcare facilities, transmission in correctional facilities, and transmission in public places like restaurants. And so all of those are potential places for risk. And that's why you see so much screening when people come into facilities or closure of those types of facilities.
Michaela Watts, Commercial Appeal. Michaela Watts, Commercial Appeal. Okay, unfortunately, we do not have Michaela, and it looks like we're out of time. Are there any closing messages?
I just want to thank both of our guests, Commissioner Mickell Lowery as well as President Shannon. And as we continue to move forward and try to live the best that we can with COVID, we'll feature other guests who can share what they're doing in their own particular organizations to reduce transmission. Thank you.
Thanks, everyone.